I'm on mute, of course. Hello, everyone. Welcome to Pitch Club. I'm Sophie. I'm Managing Director of Bayer G4A. And on behalf of the team, welcome to our Pitch Club session. Today, we'll have 4 really cool digital health startups to pitch their solutions to our relevant industry leaders in real time in front of you guys, the audience members. We do have a Q&A at the end, so feel free to put in your questions while the startups are pitching, and we'll get to those on a first come, first serve basis. Also, please remember to include the company name so we can actually direct the questions to the right companies. Without further ado, I would like to introduce our jury panel. This year, we have Doug Lee, our VP of Business Development and Licensing and Global Head of Digital and Data Science here at Bayer. Hi, Doug. We also have Michelle Ryder, Chief Marketing Officer at Marvin Health. Hi, Michelle. Welcome. And last but not least, we have Jan Hendrik Burke, a partner at B2 Ventures. Thanks, Jan, for joining. And thanks, everyone, for being here today. With that said, let's kick off Pitch Club. 4 startups will be joining today, and I'd like to welcome our very first company called Pinky Promise. Divya, Kansha, the stage is yours.
Hi, hope you can see our presentation.
Yep.
Okay, great. Thanks. I'm Divya, and I'm the CEO of Pinky Promise, and Akanksha next to me is the CTO of Pinky Promise. We'll try and be as quick as possible in the next 3 minutes. But basically, the first thing is Pinky Promise is a women's health company with a leadership team of women. I have about 15 years of experience in healthcare, started off as a biologist at Yale, got my MBA at Wharton, built Pinky Promise at that time. And between that, I worked in public and private sector in healthcare and in healthcare consulting across various countries, India, Sub-Saharan Africa, and the Middle East. Dr. Reema is an OBGYN with 15 years of experience, and she's practiced in some of the most prestigious and large hospitals of India and is an NHS qualified gynecologist as well. Akanksha, our Chief Technology Officer, has 12 plus years of experience building AI first products and has been the founding CTO twice of medical focused companies. In terms of the problem statement that we're actually solving, the big problem is in India, women actually don't go to doctors, especially for their sexual and reproductive health issues. The first is there's a severe supply-demand mismatch. Outside the very big cities of India, there are about 340 million women who live there, but only 18,000 gynecologists to cater to them. There are a total of 90,000 gynecologists in all of India. Secondly, there's a lot of social stigma and taboo associated with reproductive healthcare. So women are really afraid that they're going to have negative and judgmental experiences. So they end up just not going to a provider when they need to. What we're realizing is today with the advent of 4G internet and handheld smartphones, women are increasingly digital first for healthcare. More than 100 million reproductive healthcare words are actually searched monthly in English alone in India. But of course, if I Google my symptoms, I'm going to stumble upon a long form article that tells me I have everything from HIV to its genetic. So it's really confusing. Plus, with the burst of generative AI and clinical decision-making systems today, they could actually potentially solve the problem for women, but they have very minimal data from women to learn from because till 1993, women were just not included in clinical trials. So this leads to worsened outcomes. Like, for example, it takes about 7 years for a woman to be diagnosed with endometriosis on average. What we've realized is in India, women can be first adopters of healthcare AI. And what we've done is we've actually built a 24/7 digital clinic for women to get instant personalized care. The way it works is she can come to our app, input her symptoms and medical history 24/7. Our AI analyzes this and builds out a prescription, sends it to a doctor who's actually on retainer and duty at that time on Pinky Promise. That gynecologist rapidly verifies everything, sends the prescription to the patient in 2 minutes almost, and the prescription and the patient is then sort of in touch with the doctor for an extended period of time via a co-pilot to ask all the questions that she has for the purpose of adherence and cure. Our in-house technology relies on 2 things. It predicts issues as well as personalizes care. And we've actually rapidly grown all over India in 6 months with more than 40,000 app installs, 55,000 website users, 4,000 paid consults. More than 70% of our users come from tier 2 and smaller cities. And just the last thing we wanted to say is like in terms of our landscape today, we're uniquely positioned to improve the care experiences of women as well as improve clinical decision making. Most of our competitors in the bottom right quadrant, where they're just digital front ends with minimal decision making support, which is actually not scalable in today's time. So we're solving for that. And in terms of just our model today, we're providing instant consultations. We're just going to start providing chronic care tools as well. But the idea is to move to be a platform that supports both gynecologists as well as the ecosystem in terms of insurance and pharma, etc., because of the kind of platform we have access to. So I'll stop there. Thank you so much for your time. Happy to answer further questions.
Thank you, Akansha and Divya. I know 3 minutes is tough, but you guys did really well, and I want to bring the rest of our jury members up on stage. So now we have 10 minutes for question and answer, comments, questions, feedback. So yeah, feel free. Who'd like to go first? Ladies first, Michelle.
Well, first of all, great job. And I have a little bit of experience here because I worked at Teladoc. So I wanted to say, I'm curious about how you would gain the trust of these women, especially for gynecological issues. And I see that you already have some users, so tell me about that.
Yeah, so all the women who come to Pinky Promise actually come because they have either searched for their symptoms online and found like a long form article of Pinky Promise, or they have actually gone to social media and discovered our content. We're very digital first in our acquisition. The way that we build trust is consistent throughout the acquisition and conversion cycle. So the minute that they, for example, stumble upon our article, there are loads of patient testimonials and other stories associated with that particular issue, whatever they're searching for, that show how Pinky Promise has supported them. And then the second thing we do is we also have a WhatsApp widget that you can actually click on and immediately start talking to our team. So you have a point of contact immediately and we're able to convert you. The minute that you download our app, we have these anonymous and issue specific chat rooms, which are just free to use, where women without being identified can actually discuss a host of issues. So women typically stumble upon these chat rooms. They see the kind of conversations going on. They realize that, oh, this is a space where other women are contributing positively and things like that. And within 24 hours, typically 100% of all the paid consultations happen within 24 hours of a user actually landing on these chat rooms. So this is the process that we use. We also track drop-offs. So we call up people if they've started the consultation and they've dropped off to enable them to actually share with us what's going on. And that has actually helped us continue to iterate on these principles and continue to reinforce trust through the process.
So I'll just maybe add one thing here. So I think something that we've really noticed through our journey of building Pinky Promise is that women are very hesitant to spend on their health or their healthcare, like even a very small amount. They'll spend on their dogs, their children, they'll spend twice that amount on an Uber, but just spending on their healthcare is hard. So you have to really build that trust and like get them really, build the community, like a lot of support to get them to take that first step. But once they have and they are cured, like they've had a positive experience and it has worked, then the stickiness is really high. And I think that for us, that is the biggest way that we build trust.
Over time.
We have a follow-up after the patient gets the prescription till they are cured, where they have an open line of communication with the doctor where they can ask follow-up questions and just get clarifications. That empowers them to actually start the course of medication and finish it, and really improves the whole care cycle. And then they just come back.
Got it. Thank you.
Great, thank you. And then Doug, Jan, does anyone want to go? I think Doug is unmuted. Doug?
I can go. So first of all, congratulations on your success. It's very nice implementation of Gen AI, and we don't see that too often. I just have a couple of comments about your business model and just how you think about expanding it. So on the one thing that we see, because we have a women's health business at Bayer, is a lot of women go to their gynecologist and treat them as their PCP, their primary care physician, when actually the gynecologist isn't really trained for that. So have you thought about maybe expanding your services to include PCP services so that you can have a larger revenue basis? kind of
Yeah.
one comment.
So the way that we had thought about it is in terms of our approach, we wanted to start with issues that are exclusive to women because it's just so much easier to acquire. Because gynecology is a taboo topic in India, women actually prefer going to the internet. So we did a survey of 500 women and found out that 75% of them, whenever they had a reproductive health issue, they Googled it first. And they were spending sleepless nights thinking about that particular problem. It could be a pregnancy scare, a strange discharge, or something of that nature. So it just made more sense for us to first focus on issues that are exclusive to women of this nature, and quickly solve for those things. And then start building for issues that are then differential in women, like, for example, type 2 diabetes, cardiac issues, and other general conditions also. They manifest differently in women compared to men. And I know Bea knows this. And the third thing we wanted to focus on then is issues that occur disproportionately in women. So things like autoimmune disease, lupus, arthritis, etc. And then also in that process, we're basically spanning the entire primary care spectrum as well. We want it to be like a holistic women's clinic. So everything from if you have like a problem with your skin and hair, or a problem with whatever it could be, to reproductive healthcare and beyond. But this is the approach that we are following, like step by step.
No, that's great. And you might, because we have different businesses and all of those, it's very hard to pull all of that together. So you might think about product bundles and how you might affect that easier. Second question I had was because you're collecting all this data, right? I think there was a population. You basically had a nice implementation of Gen AI, but from a data and analytics standpoint, for the data that you're collecting, have you thought about maybe doing some population health metrics? Because if you did that, you could create some scores, and you might be able to create some insights that you could monetize.
So actually, I think that like that's kind of a part of our plan. So the way that we're thinking about our business model, we're going first to customers, then we're going to an ecosystem. So everything from companies to gynecologists or even primary care clinics to insurance companies, like people who directly deal with patients, to be able to provide our service to them. And then finally, actually working with pharmaceutical companies and insurance companies to provide insights, to be very honest, about a market that nobody knows about today, because the women in our market are just not honest about their health, especially reproductive health care, to anybody. But they are with us because it's very chat based, and they're more comfortable when they're not talking to a human being. So we know the birth control patterns of women in tier 2, tier 3 cities. We know which medicines are available and not available. Know their drinking and smoking habits better than I think their own families do now. And I think that we can really help that whole ecosystem thrive and grow and really cater to them better with this data.
And also from a public and population healthcare standpoint, Doug, in terms of your question, like it's something that we have a bend towards. So already today we're collecting a lot of data on contraceptive use and condom use, which is very, very different from what's sort of was the case in public. Because we have access to young, digitally aware women in sort of non-metro cities of India. And we're seeing that some of the population level dynamics over there are actually quite different. So the idea is to actually specialize and phone in on those insights, because they help our software as well. They help train our system as well, and they're beneficial to public health in general.
Okay,
I hope
great.
that answers your question.
So the idea is eventually to like build these data partnerships and like monetize.
But my point is, I think because you're collecting data now, I think even if you started with a simple score, right, where you can basically score the population, that might activate your business. Anyways, Jan, go ahead.
Really
That's true. Yeah.
Thanks, guys. So we have time for one more question left, Jan. We have 1.5 minutes left.
Let's maybe quickly talk about commercials. So first of all, congrats on what you've achieved with such little means. And I think the clinical value proposition, I always try and differentiate between clinical and commercial, I think is given. So well done on that. So the main question always, at least for me, for DCX, like digital therapeutic solutions, is in the fields of commercialization, right? And so maybe could you like elaborate a little on your ICP or ideal customer profile, and then we can maybe also talk about or discuss, certain additional commercialization avenues such as B2B2C, i.e., to go via your employers, etc.
So I'm just making sure I understood your question right. The first is just about our commercialization plans.
And ideal customer profile.
Yeah, and the idea, and also about our ideal customer. So we're looking at women between the ages of 18 to about 32, 33 in tier 2, tier 3, and smaller parts of India. So these are actually women who are urban, who are digitally literate, but who are not from the metropolitan cities. About 6% of India's population lives in the metropolitan cities, but about 40% is actually urbanizing, and they don't live in the metro cities. So these are women who are actually like have the same purchasing power capacity as women in the metros. They are connected to social media and the internet, and are savvy, but they don't have the same quality of care and the level of care, because doctors continue to concentrate in and around the metro cities, because that's where the multi-speciality hospitals, the IVF practices, the laparoscopic centers, all of those things are located there. A second element of our customer profile that today we are focused on, it's just a nuance, is largely women who are actually sexually active, but don't want to reveal that to their family and to other people. So they prefer these discrete online methods of consultation. And so these are like, the elements of our population. The third thing is we're not focused on the uppermost echelon of society. There's about 50 to 60% of these urban India, which are in the middle class. So they have a decent purchasing power that's growing. So I'm just gonna. I know that we're short of time.
Yeah,
so
you have 10 seconds, but we can always get to the discussion towards the end.
We are D2C because that's the best way for us to collect as much data as possible to improve our technology and build the AI. But we're already exploring partnerships with gynecologists who can have our software to prescribe so that their OPD throughput is increased significantly. Number two, with employers. And number three, then also finally with ecosystem players, right? Like large hospitals, pharma, insurance, etc.
Makes
And
total sense.
eventually data partnerships.
Data partnerships, yeah.
I'm sorry for giving you a hard time.
No, thank you.
This long question in 40 seconds. Sorry.
Yeah, no, all good.
Well done.
Thank you. Thank you to our jury members and also Pinky Promise. We'll have questions at the end. So if our audience member also has any questions, or any of our jury members have other questions, we can get to them and for a discussion at the end as well. So now I would actually like to bring up another company, our second company. It's called Soma Reality. So Julia, the stage is yours.
Okay. Thank you, Sophie. Everyone can see my screen, just a quick check. I'm waiting for a yes from the audience, hopefully. Otherwise, I'm just gonna go ahead and start because I only have 3 minutes and that's tight. So my name is Julia, I'm from Vienna. Thank you very much for having me today. And I'm from Soma Reality, and we're all about digital neuropsychology. Because at Soma, we've made it our mission to enable neuropsychological insights for everyone, everywhere. What's the problem that we see? Well, 1 in 6 people today suffer from a neurological disorder, and that number doesn't even take into account the surge in mental health issues that we see today caused by the chronic stress and problems of our time. In addition to that, we'll be short a staggering amount of workforce by 2035. So if you put these two problems together already, the situation is pretty dire, and we have something probably bad to expect in the upcoming years and decades. And on top of all of that, we've identified that there's no solution for continuous psychological monitoring just yet. And why do we think that is going to be key to solving the problem? Well, current neuropsychological tests, they're usually done with pen and paper, so they don't deliver real-time insights. And it's also not possible to measure your cognitive states, performance, all of those stuff while performing other activities other than having to take an actual test. And what's more is that they're one-time snapshots. So they're one-off assessments, obviously, that inherently means that they're non-continuous, which can lead to a limited understanding and measurement gaps. So we propose a solution, a neuropsychological monitoring solution that's based on eye tracking in a way that it's continuous, real-time. Our solution is also device agnostic, and where monitoring can happen during other activities outside like the testing spectrum. How do we do this? We develop digital biomarkers based on eye tracking, and we develop individual digital biomarkers that we will put together towards the full product, which will be the neuropsychological monitoring suite. And we've put our first digital biomarker, our cognitive load algorithm, already to the market. So CL here is short for cognitive load. And with that, we've been successfully able to generate 260K in revenue just last year with all of those great partners and clients that you see on the side. The market, there's still a big piece of the cake left. I just recently read a study where it said that within the neurology and neuroscience space alone and the digital health spectrum, there is a compound annual growth rate to be expected of 27.4% until 2027. So obviously the market is rapidly growing. And our business model is twofold. On the one hand, we do individual licensing of our digital biomarkers. And on the other hand, we also do custom solutions where we co-develop, co-create with our partners and clients to help them address the very specific high-value pain points. The team behind all of that is obviously the most important part. So our co-founders, Adrian and Michelle, have a background in biomedical engineering focused on neural engineering and programming. Our CSO, Benedict, for the better part of the last 10 years, I think he has spent his time working and researching human attentional behavior with a very tight focus on sensor-based assessments online. And me, myself, and I am doing the communications part, and I'm here in a role like today, hoping to build and establish partnerships that will bring this product even further to life. And I think I've done it. That's my 3 minutes.
You did a really great job. Thank you, Julia, for the presentation. Now I want to bring the rest of the jury members on board. And this time we're going to go in reverse. I think one question for jury member, and then we'll go with Jan, then Michelle, and then Doug.
Nice to meet you all. Thank you so much. Can I just borrow 10 seconds? I'm sorry, that's super impolite, but I wanted to say to the Pinky Promise ladies, such a cool company, project, mission, a 100% support from woman to woman. And that's it. And we can talk about some reality.
All right. Thank you.
Cool. Yeah. Thanks, Julia, for the great pitch. And I'm a big fan of digital biomarkers. We've as an early stage VC, we've invested in Altoida, which which you might know, or which you will definitely know.
Yes.
And I've also spent quite a bit of time with companies such as like Bina AI quite a few years back, and I think they've also done a great job. They're from Israel. And my main question I always have for this space is, how do you guarantee like ideally proprietary data collection to really build the model behind it?
So currently, I think, since you mentioned Altoida, that gives me a good leverage. So when you look at the competitive landscape, we're really quite different, and I know every startup says this, but we're coming at this not necessarily from a clinical standpoint. I think you said before, you always differentiate between the clinical and the commercial aspect, but our business model inherently is B2B, because with eye tracking and with venturing into this whole cognitive performance assessment space, the technology might not just be there yet for a B2C use case until, I don't know, maybe 2027, 2028. So we're going about this in a very B2B setting with corporate enterprise clients. So that's our customer group right now within the corporate wellness space, and researchers and universities. So there, we really don't need a model, since our algorithm collects real-time data, especially I'm talking about cognitive load right now, because the one that's commercially available, and is very much targeted to the user that is using it right now. So we actually have a tool that I could have running right now in the background, very simple tool that assesses based on a very high quality smart glass what my cognitive load right now would be talking to you and thinking about the problem that you had me try to solve in my head. So I think, I don't know if that answers your question, but I think it makes it easier to understand when I say we're not coming at this from a clinical standpoint, so we don't need a trained model for now.
Thanks.
You're welcome. Thank you for the question. Also, cool with Altoida. Nice to have them mentioned. Always great to have competitors mentioned.
Okay, I went first last time, but that's okay. And you did an excellent job. You answered my question, and it was about the model, the B2B model. So I really don't have another question, but I think this is so cool. I can geek out on this. So great job.
Thank you.
So I'll yield to Doug.
Okay, I'm going to jump into the business model a little bit.
Sure.
So you have a measurement technology, essentially.
You have what? Sorry.
You have a measurement technology.
Yes.
And this measurement technology can be deployed, basically in a multi-specialty care setting, right?
Yes.
So my question is, and you said that you have B2B ambitions for your customer, right?
Mm-hmm.
So how do you land your offering, into the workflow, and how do you create incentives for using, your insights in practice
Mm-hmm.
to get this transformational contract that you're talking about? You're going to have to hit some metric
Mm-hmm.
to recruit, right? Your
Right.
customer.
I mean, yeah, sorry, you weren't finished.
No, that's it.
So in the past, it's really interesting because we've been in this luxury position of where we've had at least 50% inbound. I honestly don't know where this comes from. Maybe it's just the interest in the eye tracking technology, and then you put digital biomarkers on top of it, and some VR experiences that we've built in the past, and that just has people from all kinds of industry ask about our product and how they can deploy it within their industry. So that's actually a bit of a luxury problem to have in the startup at this stage, is that we're not specifically and solely focused on healthcare, although this is where we eventually want to go, and it's 90% of what we actually do. And most of the customers that approach us or that we go out to approach, obviously that's the majority of the case still, they have some sort of environment implemented already. That's what I meant before with the custom solutions, where they just want eye tracking added on top. So that's either a VR scenario where they're already testing some kind of environment. Let me give you an example there. So the Charité in Berlin is a great example. They're currently trying to evaluate how addicts, so alcohol addicted people, react to certain triggers, and they've built a VR scenario to kind of model what is done normally with these kind of trials. And then they've put our eye tracking algorithms on top of that to get more objective insights, in addition to the patient related outcomes, I guess, or the questionnaires that they give to the people participating later. So usually these are the kinds of setups that we go for right now. With researchers and universities and hospitals, it's really no problem. All of them understand what eye tracking can add in terms of value for their products, solutions, environments. With corporate and enterprise clients, it sometimes takes a bit of ramp up. And since you said business model, we do offer consulting services on the side to also help us, in this economic climate survive. And obviously, we also have gathered some expertise in the past that we also want to sell.
No, I think you're serving a great unmet need, but I think as you go into the higher profit segments into your business model, like the insurance companies, like the self-insurance companies, you're going to have be clear about how you introduce yourselves into the workflow.
For sure, something to work on always. Thank you, Doug.
Yep.
Great. And so if that's it, I don't know if any other jury members, I think we have like 1 or 2 more minutes left. If there are any jury members who would like to ask any questions, if not, going once.
I've made enough confusion. Nobody wants to
No, this is really great. No, this is really great discussion and feedback.
Here. You did it.
Okay. Well, thank you so much, and good luck to all the other startups.
Awesome. Okay, well, great. Thank you, Julia. And then before we move to the next startup, though, just as a reminder to everyone, please post them online if you'd like, and we'll have a look at them at the end and make sure that we direct the right ones to our different startups. So for our third company, I would like to invite online iLof. Sarah, the stage is yours.
Thank you so much. And it's really my pleasure to be here sharing with you what's our mission. So my name is Sarah, and I'm the bioclinical and part of the extended team of the founders of iLof, so extended founding team. And it's really an honor to share what's our goal with you. So as you know, there are a lot of complex diseases for which it's very difficult to find the right treatment for the right person. And we are really working on democratizing this personalized medicine, this term of personalized medicine, to all patients, especially the ones that are suffering from these complex diseases, like the case of Alzheimer's. And I'm sure you know that Alzheimer's is still one of the major forms of dementia, and it affects over 30 million people worldwide still in our days. And the problem is that for 18 years and after 400 clinical trials, we couldn't really reach much information. But the good news is that we now have the first therapies coming to the market. The bad news for these patients is that the method of diagnosis is still highly inefficient, invasive, and inconvenient, as it still relies on the use of lumbar punctures and brain imaging. iLof is working to solve this problem by developing an optomics platform that is based on the analysis of liquid samples like blood-derived samples. And for this optomics platform, what we are actually analyzing and applying is an advanced photonics technology that retrieves the molecular signature of these liquid samples. So that relies not only the composition, but also the interactions of the different molecules present in the sample. And then this highly complex signal is analyzed through a pipeline of artificial intelligence that retrieves the molecular signatures, so the profiles that correlate with a certain disease. So the only way that we can do this is by analyzing a lot of different patients suffering from the disease, so that we can overcome the normal variability of these samples and really focus on the profile that is specific for these patients. Once we have this profile, we can then use these optical fingerprints, as we call them, to enable patient screening and diagnosis, but we can also use them to monitor the disease or predict the response to a certain therapy. And the only way that we see that this can be easily implemented in clinical settings is if we keep this as a minimal invasive tool based on blood-derived samples and fast and low cost that can be then easily implemented not only in hospitals, but for instance in clinical trial centers that are recruiting patients for clinical trials in Alzheimer's disease. For them, the major problem is really to not only identify the right patients for the right trial, but also to retain these patients, because then they need to be followed up using exactly the same invasive and expensive methods. The only way that this can be possible is through a lot of partnershiping with academia, industry, and of course the hospitals that provide us the clinical samples for us to test. And we have been really grateful to all of these partners that join us along this journey, and to all the funding institutions that have been supporting our work. So I'll be really happy to further detail any of these parts of our company, and it's really a pleasure to share what moves us to work around the clock at Alof. Thank you so much. I cannot hear you, Sophie.
Really cool company. I am on mute as per usual, but I'd love to bring the rest of the jury members on board. This time I shook up the order. It'll be Doug, Jan, and then Michelle. And so please take to stage, one question at a time. Okay. Go ahead, Doug.
So first of all, great innovation. Fast, low cost, non-invasive, right? That's always a nice initiative in healthcare. My question is, you have basically again this measurement platform, right, for using photonics, and it generates a massive amount of data, right, which is great. My question to you is, I know you're trying to get down the profiles, but how do you make this really useful? You have all this data, right? And how do you make it super useful? I feel a little bit like it's a hammer looking for a nail right now. So I just wondering what your thoughts are on specific applications of your technology.
Yes. So for instance, in the case of Alzheimer's disease, what we are doing right now, we have several clinical studies ongoing in different countries, and we are analyzing through our platform and benchmarking with other biomarkers that are available, and also other omic technologies to complement the data that we are also getting. But the idea is that at the end of the day, if you implement our technology in the patient journey, the idea would be that a patient that doesn't really know if they have the disease or not, you collect their blood sample, and then that is run through the equipment. You get the patient's specific optical fingerprint, and you compare that to the database that we have online with the optical fingerprints of that we have been collecting through these clinical studies. If it matches, then this will tell you the likelihood or the confidence that you have of that patient having Alzheimer's disease, for instance, instead of having a different type of dementia. That's how we are building our clinical trials. So this will be the first indication for the medical doctor to then pursue other more specific tests, which so far, for you to have an idea, the rough estimate is that it's about 70% in terms of accuracy, and the only true diagnosis of Alzheimer's is postmortem. So if we could provide this tool in order to really understand whether the patient is likely to have Alzheimer's, this will speed up not only the process of the diagnosis, but also remove a lot of negative, so false positives that are also given by the current technologies that should not be exposed to an invasive technology, for instance.
Yeah,
So
yes,
this-
sir. I would bring that. I mean, what you just said is meaningful, super meaningful, right? So I would bring that out in your presentation that you're getting this kind of signal, in your trials. That is a tipping
Yes.
point, right?
Thank you. Yeah, that's actually our beachhead strategy, to participate in these trials to help selecting the right patients for the trials. Of course, we are always confirming with the gold standards of our technology, but we cannot really do the postmortem analysis. That's why we are doing or using those retrospective samples in our clinical studies to really teach the artificial intelligence models what's the ground truth. And this is something that we will not be able with living patients, of course.
Mm-hmm. Wonderful.
Thank you so much.
Cool. I have two kind of interrelated questions. So first of all, how big is your current kind of data sample size, and how big does that data samples have to be for your users to actually qualify for a match, what you've just shared in the previous answer?
Exactly. So right now, as I was saying, we have several clinical trials ongoing, or not trials, studies. In a nutshell, we are roughly on the one. So the goal is 50K samples that we are. 1,500 samples. This is our goal for this initial proof of concept study, and this will be coming from different hospitals, so that we can also pick up on the variability of these patients. This will be our first study in order to understand what's the performance that we can have in comparison to the other technologies, and then we can validate in additional studies. So this is the current size of the data set of Alzheimer's that we have right now. And depending on the performance that we will have, then we can calculate how many more patients we need in order to get enough confidence to move these to the clinics. So this will be part of our journey to validate the technology for clinical purposes. Yes.
Understood. Like, to me, if you nail that part of the roadmap or the process, I think you've really set the foundation to very much fundamentally change the way these very, very, very big diseases are actually, or indications are actually diagnosed. So keep pushing.
Thank you.
Did you say it was 70% accuracy?
The current screening method, yes, because it's only reliant on cognitive assessments that are really dependent on the person that is developing, so the medical doctor, and the current accuracy is that one. There are already other technologies, so the more invasive and expensive ones that can reach higher accuracies, but then the process is quite different and it's more complicated for the patients.
So just for my understanding, so if you are comparing, proven, the markers of people who have these traits, and then you're getting samples from these various partners that you have, would you see the same? It feels like you wouldn't see the same markers because they might be at different life stages. And then the other question is on sort of diversity of your audience, right? Because
Yes.
we know that many people of color, for example, may not be included in these clinical trials. So how are you making sure that this is going to work for all?
Yes, so actually aligned with this goal and with your concerns, we have a different ongoing study that is focused on healthy people alone, in which we will understand what's the normal variability. So how does these different components of the blood samples change if we are talking about people with different age, gender, different regions in Europe or outside Europe, it might do some changes. Even the very technical ways in which you collect the blood samples, for instance, could affect something like this. So this is the study that we are running alongside so that we can really understand what is the threshold of a person that is considered clinically normal. And this is just in parallel to the study of Alzheimer's. In the study of Alzheimer's, what we have is controls that will allow us to have a specificity for the disease. So we know that we are including, of course, healthy controls, and we include, for instance, patients with other dementias, so that the biomarkers that we will be picking up, which will be potentially a combination of multiple factors in the sample, will be correlated specifically with the disease and not, or what is actually an action or a reaction to the disease. So it might not be a biomarker that we know, for instance, amyloid beta, that is correlated with the pathology, but we also know that the pathology induces changes in these persons, and these changes need to be somehow linked to a response, for instance, neurodegenerative response overall in the person, that can be also picked up in this signature. That's why we can also differentiate from all of the other competitors, because they are focusing on these targeted biomarkers that so far are really not working to select these patients. So we want really to add a layer of complexity to these measurements. But
Great.
This is just, I'll just give a final comment. I think there's a lot of rich detail in your business that's not coming out. So maybe as you think about your business model or the presentation as you put up, I mean, I generally think about these things of, what are you changing, how big and how fast. I think you've answered how big it is, but I think if you just start off in the beginning and say what you're changing,
okay,
right,
yes,
at your study, that would nail it right away, and then somewhere the speed of your trials and so forth. That would.
Yes, it makes perfect sense. Thank you so much for the feedback.
Sure.
Great. Lots of great discussions. Thank you to the jury members, and thank you, Sarah. You have a really cool company in the making, and so I'm glad you took the time to join us today. But next, I do need to bring up our other startup company. I'd like to bring up Quantum Skin. Great. And Joanna from Quantum Skin, this is your stage. Take it away.
Can you see the presentation?
Yes.
And let me just quickly check if I can move the slides. Perfect. Thank you very much. My name is Joanna Gushina, and I'm the founder of Quantum Skin. And let me just start by saying that every step of the way in our journey, we felt like we had a massive responsibility to address. How in the increasingly saturated skin health and wellness market to create a consumer-centric self-care solution that improves quality of daily skin health routine, is sustainable, scalable, and is accessible for all. Through our holistic product design, we connected with the consumer on senses such as visual, tactile, and olfactory. Combining the experience with a strong digital core, we formed a base for a positive habit creation that consumers can sustain. Our biggest achievement up to date, let me just check if I'm moving the slides. Not really, just 1 second. There you go. Our biggest achievement up to date is Quantum Skin is the ability to connect digital and physical seamlessly. Early in our journey, we proved adaptability of the consumer to sprayable way of ointment application on daily basis. We developed sprayable formulations and connected to the physical user experience through a digital self-diagnostics and monitoring tool. And after thousands of R&D hours and 7 patents, we now have a solution that is very intuitive, convenient, and super easy to use in everyday regimen. We see 3 market forces that support our model. The first one is the consumers shifted towards self-care paradigm and cemented their intention to overcome the shortage of services and costs provided by the dermatological industry. Second, with the health and wellness on everyone's mind post-COVID pandemic, Consumers now spend about 1.7 trillion globally each year on products and services designed to make them feel better. And these numbers are expected to double by 2030. And third is the creation of a wide space for connected skin health and wellness through an incredible projected growth in devices segment. Over the next 6 years, the growth is projected 9 times the existing figure. Our business model is based on initial sales of device and recurring revenue from consumables. With strengthening the IP portfolio, we see a clear opportunity for licensing and already have signed an LOI with a global personal care manufacturer. Leveraging consumer data business model comes in the next phase, but the digital product extension will always remain free to the consumer. Our agile team, built over the last 4 years, is well tuned to revolutionizing the connected skin health and wellness category. We have stellar advisors, including some industry legends in the consumer product and design space, as well as microfluidics. And just a few things that you need to know about me is that I have a DNA of a fighter pilot, discipline of an athlete, drive of a single mom, and 2 prior ventures and 1 exit. For the last 5 years, I've been laser focused on realizing a dream of doing good for millions of people through making skin ownership possible. Within our agile team, we managed to connect the non-obvious and build a solid foundation for legacy in skin health consumer journey. And really the only question for us that remains right now is who can join us on this journey. Thank you very much for your attention.
Thank you, Anna, for the really cool presentation. Now I want to bring the rest of the jury members on board. And in this order, we'll have Michelle, Jan, and Doug. Take it away.
Thank you. Great job. So I guess my question is on the commercialization side as well, in terms of how do you, because this is new. I don't think there are many companies that are focused on the technology side yet. And so it's on commercialization. And then it's really not clear to me who is this for. I know it's for consumers, but who is it for? Like, who's your ideal customer in this case?
This is a really great question. And actually, when we started building the product the way it is shaped now, which has a full connected experience and has the consumable part and everything else, we created we call it the first generation device. So basically, the device without connectivity and one product to pair it with, to actually apply in the way that we want to apply, in a way of spraying formulation that actually gets it deeper into the skin. So we actually made that product and we released it to market. We actually had 3 major retailers selling this in Germany and in Britain. And it actually gave us very good feedback on who is buying this, and if there's even a need of this types of application. We tested the market before going into the full-blown R&D, and that's, I think, what your question is. So of course, our majority of our consumers is 75% women. And there's I could go into like the consumer profile, but basically it's 35 or even 40 plus. Is there were a consumer that is more caring not about appearance, but more about skin health, and actually wants to connect with their product in a way of that it's more efficacy, but it also the convenience of application, and that's basically the consumer that we're aiming. But just to underline that we did test that already in the market on a smaller scale before going into the full connected experience development, where we have now the diagnosis of the skin and the connection to the device, and then the consumables to go with it.
Is this a luxury skin product though? Is it a mass?
No. We're not. We're basically aiming in kind of a we're more aiming, to create not, a skin health brand, but really, like, if you think about a connected product that you position to buy at Apple Store. So the price category would be about 169 to 189 for the device, but there's also a subscription model that will be offered on top of that to compensate if you want to get a subscription model, a very low price for the device. And basically mid-range pricing for the consumable.
Can I ask one? Can you use eventually? Is the idea you could use any consumable with the connected device, or you'll always have to use your consumable?
Okay, so our business model is built on the following assumptions. So we have developed a whole line of products to start this. We have almost 20 products developed. Well, actually 15 already registered and almost 20 developed for basically any basic skin needs and type. But how we really see this scaling, and this is, what I'm heavily interested about in discussions, is we see this an opportunity in partnerships with different brands. So cross-brand partnerships where you can buy different products that, of course, they have to fit the skin health and wellness aim.
Right.
And then you can basically position yourself even with non-obvious categories of brands where you provide a product that can fit your daily needs.
Okay. Thank you. You answered my question. Thank you so much. Sorry, guys.
Don't worry, and you've actually covered a couple of my questions I had in mind already. Maybe just a follow-on question on one of your more recent questions, Michelle, is so do your B2B customers, and I think you shared one, so congrats on the first breakthrough there on the sales side. Would they then subsidize I think you said $169 for the hardware? Because surely, they have an interest to implement that as well because of differentiation USP, right?
It really depends on whom is gonna, I think it's really a partnership model. I don't think one or the other party needs to subsidize because we can also take the cost upon ourselves partially. So it really is a matter of negotiation in terms of where that cost is going to be hidden for the consumer. Yeah.
Okay, got it.
But it's also only on the subscription model, of course, with a certain minimum where you have to basically purchase the consumable in order to fulfill that price expectation. Yeah.
Okay. And am I allowed to ask one more question? A quick one.
Yeah, sure.
So what I really like about your market is that it's a little bit of a luxury problem, right? Because you have so many different kind of application areas and across different dimensions. And as I said, it's a luxury problem, so it's a nice problem to have, but it still is one. And I'm just not entirely sure, how do you go about the prioritization of your target markets? Could you elaborate a little on that?
I think the introduction, the go-to-market strategy, of course, we have, several, there's the standard model, there's the non-standard model. How we see the introduction, and actually this is where we're looking heavily right now into collaborations with big names. Because what we found out in order to break the market when we introduced the first product, what we did was we went after known retailers. Like, for example, we went to Douglas and said, can we sell at Douglas? They said, great, let's sell at Douglas. And when you start selling at the retailer that is already known, that breaks the barrier of the first kind of product, because we did surveys of test groups where they clearly outlined that they're looking for some leverage in any product that is introduced. So first strategy is, of course, the retailers that you will align with, but actually it doesn't matter with the retailers because right now, as we have a connected system, no matter where we sell, either B2C or through retailers, we get the data. We know everything that goes on with our consumers because now we have a connected system. So first of all, going through retailers and then, of course, adding some other bigger partnerships names to increase that visibility and adaptability of the product.
Thank you, Yana.
Great, Doug.
Okay, so I'll jump in. Same direction as Michelle and Jan. I think you've done a fantastic job at setting up, a business model. which, by having the refillable and the reusable, I think I think that's great. And with the AI, you can, personalize it. I think though, that your real advantage here is to basically formulate, dispense, and personalize. I mean, that's really the core of your story. And if you can apply that to, and this is what I think the other two panelists were saying was, what is the application of your technology to the marketplace? Because there's health and there's beauty, right? And there's all these other demographics that you could take advantage of, whether it's women, male, inclusion, women of color, whatever. I mean, but just having a target market where you could apply that very core expertise of formulating, dispensing, and personalizing. And it may, working with some of these big companies, whether it's a J&J, I think that's, on the health and wellness side, or if it were a L'Oreal on the cosmetic side. I mean, that's going to really set, I think, the table. So I think you have a big decision for you. In fact, I have many opportunities, either in health and beauty or exactly what brand. I think Michelle hit it right on the nose. I mean, who is this for, right? Because you have a lot of options, right? But you're set perfectly for this.
Nailed it. You nailed it. I mean, seriously, because you're absolutely right. When we just started developing this journey, and this was 5 years ago already. We actually started with L'Oreal. We went through their Open Innovation Accelerator. They were looking at all the devices and everything else. The only thing is that the connectivity was so, and we did it successfully. We discussed it with the cosmeceuticals and everything else. But at some point, we had a very clear realization that our offering is much bigger than beauty, because as we started to develop and go through like a full-blown R&D, and now we have products actually for acne and for rosacea and for men and for, it's not about, positioning this as another, skin product. It's basically going after a lifestyle of a person that wants to take care of their skin and wants to know what's happening. At one point, they need to apply what, and it actually does a very seamless tracking for them of everything that they do without actually putting any information in, because it's literally fully connected. That's what we underline. So, but you're absolutely right. My personal preference, and this is the vision, is to go with health-oriented companies, because that's where I think the future is. And I think also, like, if you look at the market, and I think there's like a very interesting shift right now. So beauty is trying to become scientific. Pharma is trying to become a little more closer to consumer, not going to like over-the-counter formulation. So we're like in the interesting transformational space. But I do believe that that's what I call the connected skin health segment. And we're very well positioned with the technology that we already have to basically, I'm not going to be afraid to say, pioneer it as one of the truly.
I think Michelle was getting at. I mean, depending on which demo you go after, which market segment. I mean, the brand development cost is very different in each of those.
Yeah.
So something to think about. Right. Thanks, Sophie.
Cool. Awesome. Really great questions. Thank you to the jury members. Thank you, Yana. Such a cool company that you're building here. Now it's actually time for Q&A from the audience. And I know we have a couple of questions that have come in. So I'd like to sort of bring that up front. It's not too late to add your questions now, whether it's to the companies, whether some of you may have questions, maybe to even the jury members who are here. We'll also take those as well. So now is your chance to ask some of these really cool companies. Maybe it's business models, maybe it's future product development, whatever it is. Questions and feedback are welcome. All right, so we have our first question, and this is to Pinky Promise. So what patient data privacy challenges are you facing or anticipating to face with the use of large language models in your solution with your target markets? So I want to bring up the team at Pinky Promise to answer this. Akansha, Divya? Shoot. It seems like they have dropped off. So we'll circle back with the answer, but that was actually a very interesting one. I'd love to know the question for that as well. Is there a next question? I think we have a couple more. Great. A question for ILOF. How are you able to reduce the cost of running a clinical trial compared to your competitors? Good question for all of our pharma folks out there.
Yes, it is a great question indeed, and I regret not showing the numbers here, but we can reduce the costs in 40% because not only we are not using consumables because we are not doing any sample preparation and complex sample preparation before we analyze, unlike the other methods, but at the end of the day, we can also save by reducing the number of patients that need to undergo these more expensive and invasive methods. So the direct calculations is not just based on the tests or per test based numbers, which we can, for instance, right now our test will be around 100 euros compared to the others that are 10 times more. But we would also reduce afterwards in the number of patients that really need to undergo these testings. I hope this answers the question.
No, it does. 40% cost savings only costs 100 euros. I hope everyone heard that. It's really efficient. Thank you for sharing. And I think we have one more question for you, Sarah. So it says, can you please shed more light on the geographies that you're able to run clinical trials in right now and which markets you plan to expand to?
Yes. So right now our company is mostly based in the UK and Portugal. So most of the hospitals that have been involved are actually based in these two countries, but our partners are actually spread all over the world. So we are receiving samples from other places in Europe and also from the US. And the idea is that after this, we will be also trying to expand to other countries. It might be, and here the tricky part is really understanding the specificities of the national healthcare systems of each country, because then that will or might also change the way that these samples are acquired or the patient journey. So we are trying to also have that into account when we expand to other geographies that have different ways of and different patient journeys. Regarding the market, so for Alzheimer's disease, as I was mentioning, the first beachhead market would be related to clinical trials, and this would be including any clinical trial that will be analyzing new drugs for Alzheimer's or other dementias, because we are also collecting the data for the other dementias. But in true, and I didn't really show this in the pitch, since our technology is agnostic, we can actually apply this very easily to other diseases. And it might be even easier for diseases like cancer, in which we can access more data because we have also more patients. And we are also analyzing and exploring these markets. I would say that Alzheimer's is one of our additional markets that we are exploring. And it's not just one specific disease. We have been working mostly in ovarian cancer, but our goal is to develop eventually a multi-cancer panel for screening. We also did some work in COVID throughout the previous trach. And we actually wanted to use that data to see if we could develop a technology that could more easily respond and provide data for future outbreaks. So we will be also exploring that data in that sense, and we are acquiring other infectious disease, respiratory infection disease data to complement these initial studies. So the market can be really expanded, but our initial market was really on Alzheimer's and our initial indication. And yes, so any complex disease that you can find that has some representation in blood samples, and ideally doesn't really have a marker that will easily be used for patient screening and monitoring.
Awesome. Thank you, Sarah. Super interesting. If there are any other questions, probably not for iLoft, we can move on to the next one. All right. Thanks for the great pitch, Soma Reality. What is the patient population So if there's anyone from Soma Reality that can come on and answer this. So the question is, there we go. Hi, Yulia. What is the patient population that your solution is trained on currently through your studies? And how relevant is it to have a more diverse population?
So thank you for the question and thank you for the moderation, Sophie. Currently, all of the studies and the research papers that have been published are, I would say, on the DACH region. So we are currently thinking about for the next year, where we're already also collecting our funding to expand to other markets. We've been talking to the NHS quite a bit to see if we can set up a study where we compare it to a more diverse patient data set. But we can already say that the cool thing about eye tracking is that in essence, it's already very inclusive, especially within the neuropsychological realm. A lot of testing has cultural inhibitors and things that don't quite come natural to one group that do come natural to the other group. So the hypothesis here is that we won't need a lot of diverse data, but obviously we'll venture into it next year or after 2025.
Cool. Thank you for sharing, Julia.
Thank you.
That was a really great presentation, by the way. Very cool.
Thank you.
Awesome. I think we have one more question left for one of our startups, for Joanna at Quantum Skin. And I do believe we have one last question left for our jury members too. So if you guys want to stay along for that as well. So can we please get Joanna on stage? Great. So Joanna, it seems like the audience members say, this is such an inspiring story. Can you share what you have planned or a sneak peek into the next generation of your device? Whatever is not confidential, obviously, but.
Actually, that's why I think for the, basically what we're offering, just to the
whatever you can share.
Yes. Well, thank you very much, first of all, for saying that it's a beautiful story, because I truly believe it is. And we're working really hard to making this happen and getting into the hands of the consumers as soon as possible. But basically what you are going to be getting very, very soon is a fully connected experience with basically where you will be able to use a device which you don't have to maintain, you don't have to clean it. It fully connects to the backend and to the mobile app, where it seamlessly tracks your particular data of how you use your treatments, what treatments you're using at what time of the day. And it actually uses your data to give you very smart recommendations on what is the next step in your skin health journey that you need to take. So I think with that, I'm going to leave it there.
Okay.
I'm going to give out too many things for the product before it actually comes out.
So a seamless experience is what people you heard it here first, ladies and gentlemen.
It's going to be massive. It's going to be massive.
Right.
And it's going to be very affordable, very affordable.
And very affordable. That's what I like to hear. I think a lot of things are really overpriced these days. And, if you can give anyone a seamless experience and bring value, right, in whatever they're doing, whether it's health, beauty, etc.
Exactly.
That's great. Well, thank you, Joanna, for your time. We do have one last question for the audience members. I think I want to bring the jury up next. So we have, Jan, Michelle, Doug, and also, there we go. Yeah. I was going to say, and also me, but obviously I'm just moderating here. But we do have a question for each one of you to sort of end this out. And I guess it's really, what would be the one key advice you would give to startups to navigate these challenging financial times, right? We can't ignore that. Obviously the economy, I'm not going to say it's going down into a spiral, but it's going in a direction, and we all know what direction that is. But if you can just give one key advice, you take a moment to think about it. You've heard some of the pitches, but I think we have a lot of startups and also other investors in our audience today. And, what would be your one key advice? And I'm going to go clockwise because I see Doug at the top. So maybe Doug, Michelle, and then Jan.
Okay, that's a good question. A very good question. I mean, I would focus on if I and I understand that it's very hard living off the fat of the earth, and coming up with your startup idea. Um, but what I would focus on is basically the next milestone, and the next milestone in relation to a clear junction in value. So I'd answer the clear junction in value as making sure that you have an offering, okay, that incorporates customer inputs, okay, and that demonstrates the sales and marketing model of that model. So you have the product, you demonstrate. It doesn't yet need to necessarily be a repeatable business model at this time, but I would demonstrate the product and the commercial aspects, and whatever milestone you focus on next puts you on the path to that outcome. Because I think if you hit that outcome, there's going to be plenty of financing and acquisition M&A opportunities at the end of it.
Cool. Thanks, Doug. Simple but loaded feedback. But you're right. You're right. It's important to have, the life cycle for products. So, Michelle, what about you? One key piece of advice.
I know this is so hard to say one thing,
Right.
and I have a strong marketing background. So I would be really, really clear about who you're marketing to. And then make sure you have, I do this 90-day strategy. If you could market your product in 90 days, think about the touch points of who you're marketing to, how you could reach them in the next 90 days, and score against that and focus on that. So that, because I think with any business, you're going to need to prove your concept. You're going to need to sell into a market. So you got to get really, really clear on who you're marketing to. Think about if you only had 90 days to market to them, and then make sure that you can have touch points that are relevant to that particular market.
Awesome. No, super helpful. And you're completely right. I think a lot of startups actually underestimate the power of marketing. I see that a lot, especially in healthcare. So thank you, Michelle. And then to you, Jan.
Yeah, I think mine goes a little bit into the direction of Doug, and I would really focus, because I think you or like all of you founders are still in quite early stages. You should really focus on really creating your ideal customer profile in an as narrow and concrete way as possible. So don't say, oh, we want to speak to all people in India, or all women in India, or all users of Douglas, as we just said. I think we need to be a little more concise and precise there. And then really focus on creating an immediate and also quantifiable value proposition for these defined users. And why do I say immediate? Because I think there's a loss of vision here, and this is great. And especially me as an early stage VC, I love that. Like thinking about what will happen in 10 years time. But we need to have a value proposition now, or like as soon as possible. And if you bridge that road to value proposition through some kind of, let's say, non-productizable ways, through consulting, what we also discussed earlier, that's totally fine, especially in these headwindy times, right? Yeah, I hope that makes sense.
No, absolutely. Absolutely. And thank you again so much to you, Jan, Michelle, Doug, for joining us today, and to our audience members for the really cool questions, and also our 4 companies that pitched. Their information will go up online. This is also recorded as well, and we'll send it out through our channels. You can follow us at, I just need to make sure that I do this right. You can follow us at G4A, at G4A Health, which is our Twitter. But also, you can keep connected to us as well if you really want to send us an email, info.g4a@bayer.com. You can continue asking us the questions. We can get it to our startups. If you want to get connected to any of these startups from our pitch club today, feel free to also drop us a message as well. And thank you so much, everyone. This is it, and hope to see you again at our next pitch club, probably coming to you in 2024.